Hi, welcome to the panel. My name is Hitesh Dolani. I'm a dentist. I teach at Harvard Dental School. I practice at the Forsyth Institute, and my interest is in increasing access to care using telehealth services for dentistry. And today we have a pretty impressive panel here. When I was asked to moderate, I was asked, do you want to do this? And I thought to myself, do I want to do this? And I got the panel list, and I was like, yes, I definitely want to do this. So thank you for letting me moderate you today. So I'll give brief introductions, and we'll dive right in. We have Dr. Ajay Kumar. Dr. Ajay Kumar is the founder and chairman of Healthcare Global Enterprises, which has helped develop 27 private oncology hospitals all across India. We have Vishal Bali. Mr. Bali is the head of healthcare for Asia at TPG Growth. He's also the co-founder of Medwell Ventures, which is pioneering home health and chronic disease management in India. And then we have Dr. Korakivala, who is India's leading research-based global healthcare enterprise. They deal with pharmaceuticals and many other healthcare industries in India. So this is truly an all-star panel, so thank you for coming. Before I get started, we're going to focus on some of the innovations that India is having, some of the innovative business models, and what some of the hurdles still India has. But if you have anything in particular that you'd like for me to focus on, I'd like to kind of get that idea now so I can try to lead the discussion today towards that if we have specific interests. So does anyone have anything dying that they're trying to learn about India that I could steer towards? Yes.
Yeah, we'd like to focus on the rural healthcare and how the urban healthcare system is kind of uniting the rural healthcare. Great.
Thanks so much. Yep.
Indian government has the concept of primary healthcare centers. So how can what practices or what services are available to improve that government-based delivery system?
Great. Okay, so we have primary health care, we have rural health. Quick topics, yeah.
The opportunity globally in biosimilars.
Okay, and one more.
Research and development in India use cost-effective vaccines and drugs. Research skills.
This guy will answer that question really well. Okay, so I'm going to go ahead and start with just an opening question for all of you. We're seeing that India is truly leading a lot of innovative things in healthcare. So what do you think, in your specific industries, what do you think those innovations are, and how are you going about doing them?
So, after you.
Yeah, you should start. Let him start. We'll walk.
Yeah,
this way.
TPG, right?
No, because I have a lot for you.
So the caveat that I wanted to put over here was the reason why I was asking Mr. Korakivala to first talk was I actually worked for him for 19 years. So, so a lot of what I know about healthcare was actually taught in an institution called Wokhart. So I have great respect and for the mentorship that I've had under him. So let's just, I think you talked about innovation and what's happening in the Indian healthcare delivery landscape as far as innovation is concerned. I think both from the financing side of things and on the delivery side of things. So we've got to sort of keep both together. So let's first talk about the delivery side of things. So if you look at the last couple of years, one of the big changes that the Indian healthcare delivery landscape is going through is a sudden burst of startups happening across the ecosystem and breaking down the healthcare delivery ecosystem between hospitals, diagnostics, specialty chains. All of a sudden you're seeing the new breed of specialty healthcare institutions which are coming up. You've begun to see specialties moving out of hospitals, getting into 50, 60 bedded standalone ventures. So there is a huge ecosystem which is developing. The company that I've co-founded, which is in the area of home health, all of a sudden home health is again a new ecosystem which is beginning to take off in a big way in India. And the reason why all that continues to happen and will happen for a long period of time is basically because India still pays 60% out of pocket. I think India hasn't reached a level as yet where the drivers of insurance pull the weight of innovation not letting it happen. And that's one of the biggest advantages that the Indian healthcare ecosystem faces today, that because it is pushed against the wall around affordability and accessibility, it will continue to innovate new healthcare delivery models. And that is happening across the country. So it's not just happening in the tier 1 and the metro cities, it is happening in the tier 2 and the tier 3 cities too. So, to answer one, innovation in the way that healthcare delivery is beginning to happen. And if you now look at what's happening on the financing side of things and look at the way that private equity, venture capital, has begun to play a big and significant role in the way that startups are getting funded in the country. Over the last couple of years, year on year, there's $1 billion of invested capital that has gone into the Indian healthcare ecosystem, which just goes to show that the amount of interest that capital is now having in terms of healthcare delivery and in terms of participating in the overall healthcare delivery ecosystem of India at an all-time high. While valuations, somebody could turn around and say, are the valuations really panning up to the realities of those businesses? Probably not, but that's what hyper-valuation games are all about, because capital is now beginning to chase good companies. So a great time, from a healthcare delivery perspective, both from an entrepreneurship in terms of being able to create and deliver new models, and also being able to get the capital to fund them.
How about you try to use this so I can have
Okay,
that?
can you hear me?
Is it on?
I think it works. Does it work?
Does it work now? Can you hear me?
It was.
Yeah. Okay, Hitesh, you asked the question about what are the learning curves in terms of doing innovation in healthcare.
Sure, you could say I asked that, but okay.
But what I want to say is, like Vishal talked about the finance part of it, private equity. What I would like to say is, in my own learning experience in oncology, having seen what was in the United States for a long time, having practiced here, going to India and trying to do oncology. At that time, oncology was considered the pits in terms of profitability. It was felt, when you look at the ratings, it was cardiology, orthopedics, everything. The worst was oncology. And oncology was mainly done by trust hospitals or government because it was considered not profitable, something you do as a social service. So somebody, either the government does it or somebody has some issue in their families or so, they start a trust hospital oncology. So what has happened in the last decade or so when we started putting said, okay, only way you can do right is the right way treat cancer patients. You cannot compromise. When with that intention we went, we have to realize India is multiple countries within a country. It is not a single country. You have 300 million population, which is quote unquote middle class, affordability is there, whereas you have 900 million, which is totally different. And how do you bridge the gap is also a challenge. One of the persons asked a question about rural India and others, which we'll address later. But, the question is, are you going to focus on this 300 million and eventually trickle it down to the others, or are you going to take on the whole gamut of 1.2 billion? So what we decided to do, oncology, very quickly realized there is a great unmet demand even in the big cities. So usually people were treating cobalt treatment or a truly inferior form of treatment, saying that we are a poor country and doing a great disservice to the patients by causing more side effects, problems. So a poor man not only gets inferior treatment, more suffering. So I take a contrarian view. A poor man actually should get the best of treatments because the disease should not come back. So how do you bridge that? How do you achieve that? So in a private setting, it's certainly a challenge. So what we did was, in the innovation, using a hub and spoke model, creating a center of excellence with high-end technology, focusing on outcomes, quality and outcome. When a cancer patient comes, whether it is MD Anderson here, Sloan Kettering or HCG, what are they looking at? What is my outcome? That is why they come, So when you bring in the same level of outcome as other countries and then create a model where capacity utilization, so you at differential time, somebody comes at 11 o'clock in the morning, gets the best, maybe gets a cup of coffee in the treatment, and somebody comes at 11 o'clock in the night and get a subsidized therapy, maybe not cup of coffee. Can we do this? That is the challenge we faced. And we have done it so far successfully with 30 centers, and a paradigm shift in oncology has taken place in a very short period, like 10 years, where we can now say our outcome, which has been studied by HBS also, saying is equal to best of centers in United States. Now the challenge is, how do we take it not just 30 centers? Is it possible to do 100 centers? Can we go across using technology, teleradiology, telemedicine, virtual tumor boards? Is it possible a person sitting in northeast corner of India can get the same level of treatment sitting in Bangalore? That is where we are.
So I guess innovation is very relative. I mean, for India to set the standards and then prove them out, do well, treat everyone at the same standard was also a huge innovation. And now you're looking at basically scaling that. So I mean, that's amazing. But great. So now we'll move on to you. What do you see as some of the leading things that India is doing for innovation?
Let me share our own experience, basically. We are basically a pharmaceutical biotech company, started off, and sometime in early 90s, I thought personally, the quality of healthcare is a big issue here. So we started with a facility in Bangalore where Vishal was with us. That was a heart center, and we tried to create, from a clinical outcome point of view, a center for excellence and develop a business model which is successful, at the same time gives this. So from then on, I think we then tied up with how do we scale it up to this? It's good to manage one unit, but to manage a series of units and provide the same kind of clinical, that is where we had a relationship with this Institute of Howard Medical International. And this is still there last 15 years. Now what we have been able to do is we really focus on an unmet need in a community. So in metro cities, we have created a tertiary care super specialty hospital facilities and raise the whole bar of the clinical outcome far higher than what was there. We did in Mumbai, we did in Bangalore, and that was what we achieved. And we saw over the years, and that was the purpose why Harvard got associated with us, to raise the community bar of quality of outcome. And then the other challenge which we tried to address about 10, 12 years back was in second tier cities. There is no tertiary care facility worth its name. And we are in a vicious circle. There is no facility, there are no doctors, specialist doctors available like cardiologists, cardiac surgeon, neurologist, neurophysician, and so on and so forth. And therefore we started these hospitals in small places like Rajkot, Nagpur, Nasik, where they had no tertiary care facility. Patients were going all the way to larger metro cities. And we were able to attract some of the finest good talent into those cities who are not there. That was mainly because the way we had operated earlier. So we had developed a very good perception in the medical community in terms of the way we operate, the importance we give it to a doctor, allow them to practice the right way. So all this has helped us to do in tertiary care. We just opened a new hospital in Mumbai South, and we are now moving into a third level of establishing the excellence in the city and probably, hopefully, spread over the country in terms of building the a kind of infrastructure. For example, our entire hospital is an error-free, we call it, because everything is computerized, including the clinical outcome and all the data, what you see in intensive care or a doctor's prescription or everything. And they are all interconnected. So the information available for treatment is on a real-time basis, whether one is in ICU or operation theaters or anywhere. So that's a new level we are bringing into the focus. So I think that is the kind of innovation. And in fact, when the Dean of Harvard Medical School came to visit our Mumbai hospital and inaugurated, and he commented, I wish we had hospitals here in Boston at the same time.
Vishal, you had mentioned the role of private equity and a driving force for innovation being that that the cost of healthcare needs to be low because it's 60% out of pocket. So how does private equity money come in? Because right now I think all three people here are serving the private market. It's so difficult to really make money off of rural India or any of those. Is there venture money being put in for that, for that sector, or how does venture come in to even profit off of those? And then the final thing I want to ask you is that, are you seeing more innovative business models in India to target that population? Because there is money to be made, just a matter of how it's being made.
Correct. So, I think as far as venture capital money is concerned, number one, the number of innovative models that are currently in practice in India is happening both on the delivery side and on the medical technology side, right? So, in fact, back in Bangalore, there is a very interesting company called Forus, which has got a diagnostic device for cataract and for eye disorders called Trinetra, right? And that one device actually diagnoses 5 different eye ailments. And we have probably the largest number of visually impaired people in India compared to the rest of the world. So, and this device actually does this activity of diagnosing in less than $50, right? So, and this is just a handheld device. Similarly, there is another very interesting company which is doing something similar in the area of diagnostic testing for diabetes. So all of a sudden, you're seeing this ecosystem spiral up, which is basically around there is underdiagnosis of disease. So what kind of technologies can be put in place where the diagnosis of the disease can be much better and much more, both in rural and urban India? And predominantly in rural India, because that's where the biggest issues are happening today, where diseases are going unchecked. So, 63 million diabetics in India, which is the diabetic capital of the world, and half of it is still underdiagnosed today. So there is a lot more that is beginning to happen in that space. So then coming to the delivery side of things, we are finding that the new age delivery mechanisms are happening both in semi-urban areas as much as they are happening in the urban areas. And VC money today is chasing both almost equally. Because ultimately, because of the fact that everybody realizes, and both the private equity funds and the venture capital funds realize, that this is all about the fortune at the bottom of the pyramid, right? But this pyramid is not just so hollow, because there is enough and more affordability which is out there. It is just that the mechanisms of delivery are not available. And many of the people from these semi-urban cities in India actually travel to the urban cities to get themselves treated or get themselves diagnosed. So everybody is realizing that if at the end of this chain, if one can make healthcare delivery happen in the semi-urban cities, then a lot of diagnosis and treatment can happen there itself. Because today, out of the 10 people who get diagnosed in a semi-urban city, probably 3 will travel to an urban. Right? So there is a fallout rate of 70%, which doesn't get treated at all. So the VC hat is today looking at it and saying that if these 7 people were to get treated, even at a much lower cost compared to urban India, then there is still capital to be made over there, and there's still profitability to be made over there. So I think the idea is that at the end of the day, India is going through a huge revolution right now in terms of the delivery of care. Coming through different models, different funding mechanisms, because also what is triggering many of these is that there are a lot of, and somebody said that there is a huge government infrastructure. There is also government funding which has begun to happen for a lot of these healthcare treatments. Right.
So that actually leads me to another great segue here, is that here in the U.S. we actually, fortunately but also unfortunately, have a lot of government regulation that stymies innovation, but in a way is appropriate because they're looking at outcomes, proof that it's not going to be harming you, et cetera, et cetera. How does the regulatory landscape in India, and this is a question for all of you, how does the regulatory landscape in India benefit, but also maybe stymie some of the innovation? Do you think it's more beneficiary or hold you back?
I think let me just give you a picture of how healthcare is being managed in India first. India spends roughly about 5.5% of GDP on healthcare. Out of that, government spend is only 1% of GDP, which is unlike most of the developed countries. Another 30% comes from insurance, which is mainly urban areas coverage. So the majority of healthcare spend is by individuals and they pay out of their pocket. That's the kind of scenario basically is there. Now, I don't think government regulation is a kind of, I would say, hindrance or otherwise to the delivery of the healthcare. There, I would put it in a fairly neutral category. You need some regulation, and those are there, and it is not over-regulated space. I think what is actually happening here is that even in future perspective also, the government do not believe that they can do a job of providing healthcare. So therefore, in this new budget, the government announced that they would cover everyone in the rural area through a government insurance cover. All they have to pay is 1 rupee a day. So, and I think what will it do is really it will stimulate the healthcare delivery mechanism and system and approach in the rural part and other part of India, because they would they would recompensate them, and the government will take the burden of delta difference, and in the process they would do it. So I think this is a very smart move, I would say, that the government is not trying to create their own healthcare delivery, but ensuring people and then compensating, dealing with that. So I think that is going to give enormous spurt in the healthcare delivery in the rural India. So that was, is there any other part of question?
No, that was great. I actually didn't know that, so that's wonderful. Hope that answers your question up there a little bit.
Yes. Yeah.
No, the government regulations actually so far has been very minimal in the private enterprise. I think the reason, whether you take oncology or cardiology or lot of this tertiary care and some secondary care has improved significantly in the last decade, is because consumer is the king in India. And he or she regulates a lot of things in a way in India. That is the one phenomena of India which we feel is a net positive. Because the role of insurance company has been limited. When you look at the US model, it is the Medicare, Medicaid, and the insurance companies which have brought in a lot of regulations. A lot of it is related to the economics. And so what has happened in India is, since the consumer, the patient, and the family are dictating 60-70%, it has really brought in high quality of care and competitiveness. Today, India is the cheapest healthcare provider in the world. Cheaper than African countries, majority of African. And I don't think this would have been possible if it was heavy regulation was there. And that actually now is translating to high quality of care. But what is happening looking at the future is somewhat scary, because there is the saying that no good deed goes unpunished. So we are all going to be punished for having done this, as you know, so now we call ourselves social entrepreneurs. We have gone back, done a lot of this work. How to bridge the gap between the wide disparity, the middle class, the rural India. While we are working on that, government has started interfering now, because they have seen great value. Like, these guys have done something we are not able to do for last 60 years. So let us see how to spook it, how to change it. And so what they have done is they have suddenly become altruistic. They say, we want healthcare for all. Not just below poverty line, even above poverty line. Dr. Kaurikawala can go and get free treatment now as an APL card holder. We all of us can get. So this is the extent to which they have gone, and I think this will to some extent destroy the system, what we have done. Good intention is there, but is likely because high quality of care has been brought. Our motto has been a person who can afford to pay should pay. They should not get free care. They can go for insurance. If they don't want to go insurance, they should pay. The person who cannot, below poverty line, the government can help. And we can have a system where we agree on a certain reimbursement for those people. So this is a model which is working well, with great vision has been put, but now the government of India, the state governments have started looking at this APL business and all, which I think will cause great damage to the Indian healthcare going forward. The government should focus on primary healthcare. Like Dr. Karkiwala said, they should be monitoring agency, provide insurance for them, and make sure, the quality of care is maintained. There should be a monitoring. What has happened? Are you providing the right quality? The system in where the patient can report to the certain boards if the quality is not there, if there is any instances. And not only that, the government is now going into pharmaceutical manufacturing. Imagine that they want to, Ayush they call it. They want to manufacture drugs and dump it in the market. Imagine what will be the quality of these drugs. So it's a scary thing. Honestly, it's a scary thing what they're trying to do.
Well, you have a different view, so I'm gonna let you.
I have a very different view.
So Dr. Karakiwala is a HBS graduate, so he's gonna bring back the time where he disputes the question in class.
No, I honestly feel that government is on the right track. In fact, it is unfortunate that a large part of India's population is uncovered by healthcare. And if you really not look from a healthcare industry point of view, but look at people point of view, what happens to a citizen, I think they were not cared for. And there are just not adequate healthcare facility available in rural areas or semi-urban areas. And I think government with this insurance which I described is making an attempt to reach out to everybody. It is to my mind, it is a transformative measure the government has taken in making possible. It may not happen in shortly, but gradually we are moving towards providing more kind of a universal health care, where Obamacare is in a great debate going on in spite of the law which has come here. But you look at Europe, look at Japan, look at most countries in the world. Universal health care is what the government provides.
I think what he's saying, though, is that in the U.S., even though healthcare is being provided, universal healthcare is trying to be provided, the government is not making the medication or trying to implement the healthcare. They're just saying, we got to do it. Whoever's doing it well should keep doing it.
Yeah, absolutely.
But do you feel that the government?
I think we have a less intrusion in India in the healthcare by the government than any other developed countries in the world. In fact, patient has a choice to go to anywhere they like for their consultation, for their treatment, and that's a choice available. And therefore, an individual is in a way, what is our system? It drives economy, it drives the quality of care, because a person makes a choice, not that state makes a choice or your insurance company makes a choice. So I think that system is being preserved and continued. Obviously, in this process, when the government pays for the insurance, they will put up the rates and things like that, which may or may not suit some people.
I have this. Okay. No, I think, Ritesh, what we have to take a look at is that India has actually been home to a lot of innovativeness, right? And we actually undermine the innovative index of India as far as healthcare delivery is concerned. And I'm sure that most of the class sitting over here and everybody at some point or the other would have gone through the Arvind Eye Care case, right? 2/3 of the patient population of Arvind is treated free of cost. And guess what? It is one of the most profitable eye care ventures that you can see anywhere in the world. They have funded all their capital themselves, all their expansion themselves. And when you look at their entire integration process, when they came up with that intraocular lens, what was being manufactured in the US for $200, they were doing it at $5 with the same company which actually gave them the IP out of the US. So I think we've got to understand that there is enough and more of innovation that has been practiced in that country.
The question, though, was about regulatory hurdles in that. Like, do you feel that India
I don't
is supportive?
I don't think that there is. I think the enablement for healthcare, and in fact, as Mr. Karakiwala said, that I think India, from a regulatory perspective, and particularly private healthcare in India, has been let loose for quite some time. right? And while the government has this larger altruistic motive of trying to create healthcare for everybody, but I think they also understand the fact that they just cannot do it themselves, right? And that is beginning to now happen, because if you see in budget after budget, the government is actually almost static in terms of the amount of money it spends on healthcare. In fact, this year's outlay of healthcare is less than what it was last year. In fact, there is a reduction of almost close to about 5% in terms of the overall outlay. So, which is good, because then what's going to happen is that new models of healthcare delivery are going to get more and more, catalyzed to grow.
So you're the Asia head, not just India head, but Asia head of TPG growth. And I'm sure that you've seen a lot of innovative models come through your table. Some you trash, some you are like, this is amazing. What are some of your favorites that you've seen in India right now that are, hitting the ground that you've liked?
From an India context?
Asia context.
Asia
Like what are
context?
some of the best innovations you've seen?
So I think, if you look at Thailand, and if you see the way that they have implemented universal healthcare coverage, probably the best example in Asia. I don't think that there is any other country that comes close to Thailand, the way that they've covered their population, and it's a pretty populated country, and again, it's not a rich country, right? Vietnam is currently going through a similar kind of a process. Vietnam has largely been government oriented.
So I think I'm more talking about like actual like companies, innovative models, business models that that you have maybe invested in. Since it is the Indian conference, maybe we should keep it to India. Sorry, that was my fault. I said everywhere, but
yeah. So we recently invested in a company called Sutures India, which is basically an Indian homegrown manufacturer of medical consumables. They are taking on the likes of J&J, and guess what? They are the 4th largest suture manufacturer in the world. And they're sitting in the backyard of Bangalore somewhere, and half the world doesn't even know about them. And they're already the world's 4th largest suture manufacturer. So this is the level of expertise that sits in that country. And many times you just don't know that there are these powerful companies that exist over there. And in fact, we've not only increased our stake in that company, but we have now integrated it, and we are in the process of actually putting a bolt-on with a UK company, so that this company can then go and export its consumables to the rest of the world. So that's where you see examples like these from within the country, and you want to take them global.
that's great.
Let me just add to it. See, one of the things we have to appreciate is that in healthcare and medical field, there is a very major changes taking place worldwide. The old models are discarded and new models of management is coming. One of the advantage of India is we don't have a legacy organization and structure very strong, unlike the Western countries. When you have a legacy, to change anything is not easy. Whereas when you start on a literally clean slate, you can leapfrog technologically, leapfrog structurally how you want to create. And I think that is what one would see happening more and more so in India. And that is what Vishal is alluding to.
When you walked in, we talked a little bit about evergreening, okay? And India is patent evergreening, and India, as some of you may know, set a global standard by saying that evergreening was not going to be allowed. Which, I mean, I didn't grow up in India. I'm Indian, but that just made me incredibly proud of this country. But a part of being, in industries that are making so much money, there's always this responsibility of, social entrepreneurship or giving back, and it seems like India is is starting to become more and more that way also. I think for companies, that's really important. So, in your own way, what ways are your companies doing this, or how are you seeing other companies in India who are starting off now, trying to be socially responsible?
I think let me talk generally about India rather than my company specifically, if you don't mind.
Yeah.
I think in terms of especially the medicine space, India is becoming a very major power in the world, in the sense that, for example, the HIV/AIDS medicine, it was Indian companies who produced it at a very small fraction of the cost. and made it available in Africa and other countries. And that's how you see the management of India. Today, 75% of drugs supplied worldwide for AIDS come from India. Vaccines, which is WHO buys it and all other companies buys it, and all vaccination program worldwide, 60% of that is being manufactured in India and supplied worldwide. I think this is something, and this is increasing. Even in our, in USA, for example, Indian companies had very limited presence 10, 15 years back. Today, 22% of generics supplied in US is supplied by Indian companies, and that is a kind of competitive advantage, edges we are creating. We are competitive in the US market and obviously other market. So Indian companies are doing a tremendous job as far as the pharmaceuticals are concerned, both in terms of making affordable medicine worldwide, and I think India is going to become the probably center in years to come to supply affordable medicine on a worldwide basis, and also being competitive in a market like US and Europe.
Okay.
Hitesh, I'm not done with regulatory.
Please, I'm so sorry.
So I want to say one thing, as a doctor, since I'm only doctor sitting here. You know.
Well, me too, but
You are. So I just want to say one thing, that when you look at innovations, when you look at government regulation and all, you have to focus on what is the end user, what is happening to the end user, patients, the outcomes. In our own study for cancer, government regulated program versus private, 40% more mortality in government regulated. Because when the government pays, they pay fixed small amount and they do not pay for complete treatment. And the patients who come, unfortunately, and think they are getting the optimal care, they are not. So that is where the major problem is. That is where our issue is when the government says, everybody, we don't have any problem insurance, people getting insurance, private insurance. But the government becomes the body of providing insurance, government also has hospitals. It becomes, is nowhere in the world any country has succeeded in this kind of a model. So that is where the issue lies. Regarding the pharma, since we deal with a lot of oncology drugs and all, I just have to say one thing, that while we have the cheapest drugs, pharma industry, we are very big in oncology products compared to Africa and all, we are much cheaper. And the question was asked about the biosimilars. One of the things which is concern to me as a doctor and also involved in R&D work is we don't have innovation in new drugs. See, we are essentially more like copycats. We take somebody's products and produce. Biosimilar, for example, a drug called Herceptin has been produced in India now at a much cheaper price, which is great for the population. But the concern is there is a big blockage of drugs coming into India now. They're not that easy anymore. Because what has happened is a lot of multinationals are hesitant to bring in because of this.
because of the evergreening.
Yeah, huh?
Because of the
Evergreen, yeah. So this is an issue going forward. So we have to create, my suggestion has always been, let there be a global body like, the global, the Hague or somewhere, where the decision is made what is evergreening, what is the thing. So all the countries have to follow. There cannot be a rogue country, which upsets the balance. So it has to be done in a proper way. And how you are going to do it, how you are going to benefit. For example, you talk about AIDS, Africa. Through means, Africa has been survived through the AIDS. They didn't go on copycat. So I would suggest there be a body which monitors globally and takes care of this issue, so people who can benefit from newer generation of drugs will not be deprived. That is the problem.
So one of the things that this question originally was about social responsibility, and I'll answer the question kind of for him, because I was talking to his daughter last night, who is heading up the foundation that they are doing. What was interesting to me was that how they go about, almost everyone in India to some degree is needy, but how they are going about, being socially responsible and deciding which people, need how much and so forth was very interesting to me. So I'll just say that, adding a foundation to some of the work that you're doing is pretty impressive as well.
No, and I think there's also the New Companies Act in India actually mandates companies to flow back some part of their profits back into CSR. And I fundamentally believe that's going to be so much of capital available within the country because the larger part of the Indian corporates are doing phenomenally well. And there is going to be a large pool of capital which is available. And I know talking to various companies, most of them want to give their CSR impact money into healthcare ventures. So that is again going to be another new catalyst which is going to come in the form of capital being available for various healthcare initiatives within the country. And that's also going to give rise to the ecosystem evolving a lot more, where this is like impact funding, right? So, but it is coming in through a different channel.
Right. We should have more time. I want to take some questions. So, how about you right here?
Just one question for the panel. We have talked a lot about all the various aspects except one, which is enhancement of capacitation, mid-career training of healthcare professionals. Now, what are the business models in India which we have for that? So, as ambassador of India in Chile, I saw a business model which was very successful and very, very, very high completion rates through e-learning. Now, that was by the cousin sister, the president of Chile incidentally, the healthcare professional herself. Would that have any relevance in India? How would it be, implemented? How would it be effectively implemented? Those sort of models.
Want me to answer that? I think training of healthcare professionals in India is currently one of the biggest priorities. I think as a country, for the kind of healthcare infrastructure that we need and the number of healthcare professionals that we need, both on the medical, paramedical and on the managerial side.
This is about the mid-career training also.
Correct. It's largely underserved. So e-training is one of the biggest ones. And as you may also know that the National Skill Development Council, the NSDC, is trying to do that for the ones who are less educated and trying to skill them in, and many of them are probably going to join the healthcare ecosystem as caregivers and as health professionals who are just going to come in and provide support services. I think that's a big necessity, and e-learning is going to be probably one of the biggest drivers of mid-career reorientation and also new career reorientation or orientation per se.
Wait, we should take someone else's questions as well. You can afterwards. Go ahead.
So there's clearly a debate about government involvement in insurance and patients' ability to pay. With 60% of payment coming out of pocket, we're seeing we see that there should be an insurance kind of a system in India. Do you think that India should move towards an American system where it is predominantly a private insurance base, where the government subsidizes Medicare and Medicaid? Or do you think the British system, which is currently really creaking under inability to fund, do you think the NHS is the right way to go? Because India is clearly one of the lowest, Indian government is clearly one of the lowest 1.5% of GDP healthcare. So do you think, which way do you think the country should go?
See, we must recognize the American system. There is no question the healthcare available in America is the best anywhere in the world, amongst the best, if not the best. But then look at the cost of the healthcare here. It's 17% of your GDP versus European generally between 8 and 9%.
Unfortunately, we're not the best, but...
So in terms of effectiveness, and the European lives 5 years more than the Americans. So if you are looking at an outcome of an healthcare, whatever we may talk and criticize about the European system, it delivers better results for its population. Now, therefore, I think India did not follow any one of these systems. And therefore, India cannot, and anything which the government will do, and that is a criticism of the European system and some of the things, even with the insurance companies here, is I think we have to evolve a model which takes our weaknesses and the strength and create a model. And therefore, I believe that this kind of insurance model is something which allows the private people to come in, and government supports it through universal insurance coverage. So I think it's a fairly good, effective model. And I think India will create in many areas, healthcare and otherwise, a different model. Because we live different times, we have different kind of issues and different kind of problems to deal with it. And we just cannot follow and succeed the models of the US or Europe or any other countries. It won't work for us. It's not that so we have to create and learn from all these models and experiences and create a one which will be appropriately suitable for us.
Hitesh, only one thing I want to add is we have to do in phases, learn from others'
One
experience.
comment on patent.
We have to do in phases.
And biosimilar.
Where, the below poverty line should be first addressed. The real below poverty line. Take care of them, which is quoted figure is 22% of the population. Then you move on to different phases. Till then, let the system be as it is. Address the below poverty, learn from that and move on. I think if they do it in phases, it will go very well. It is just a question of trying to do all at once. I don't think it will click.
I think I just want to respond to biosimilar comment which you asked earlier. I think biosimilar industries are doing quite well, and number of biosimilar products have been introduced in India, starting with hepatitis vaccines, APO, insulins, and some of the monoclonal antibodies introduced. So I think those medicines will be available in India, and I believe that in a reasonable period of time, India would be one of the suppliers to emerging market, the biosimilars. The regulated markets like US still have to come with a clear policy framework of how they will going to treat biosimilars. So it will be quite some time before one would significantly enter the US market. European is already arrived at some kind of approach for the biosimilars. So I think, excepting US, most of the world has a legal framework available how to move for the biosimilar. The other fact which I just wanted to highlight, that what is the role of medicine in treatment? Even in United States, 84% of prescription for medicine are off-patent products. So the reality is, that is true in almost all countries. So it is the newer products which deals with some of the newer diseases, unmet needs, and so on and so forth. So I think there are two ways to look at it. What kind of approaches one should follow to meet generally more acceptable situation. And I think what India is following in terms of patent is a multilateral trade agreement, which is arrived by all the countries in the world, including United States. Now, obviously, some of the US is raising issues with India on the patent compliance, mainly because they could raise it in the World Trade Organization to resolve issue, because India is complying with that fully. And what is this agreement is, it allows innovation and the patent right fully to in a basis, accepting that minor changes which do not add clinical value do not allow, and it's a evergreening, call it.
Sorry. So who has the last best question? Who said I do? Okay, but no, we already called on you. How about you right here? Yes.
Hi, I'm actually an internal medicine physician, and I spent some time in India looking at healthcare this year, and I was really surprised at the corruption and the lack of regulations dealing with issues that I saw in hospitals, such as privatization, quotas, let's say, for extra procedures that were not necessary, cardiac CATs, MRIs, people having length of stay increased by 1 or 2 days because their uppers told them to do that. So I was just wondering if you could address just medical regulations for physicians in India dealing with.
Actually, you're the best person to answer that. You already have it.
I think the regulations are coming. So what you have to understand is, in India, we have come from a very low base in the last 2 decades. Like if you were practicing in the United States in the 70s or 80s, like I did, it was a similar situation there. A lot of work was done. People were admitted for tooth extraction, inpatient, done the way, primarily because of economic reason. So we are going through the phase of self-correction. Like now there are a lot of things insurance companies are putting in place. Even in US, all these regulations came through insurance companies, as you know. And then, so this is what is happening in India. When you have 60% who are cash paying patients, obviously there's this kind of overuse will happen, but it's very unfortunate, particularly in diagnostic division and certain areas, it is totally abused. But self-correction is taking place. I just read today some 13 doctors were put in jail or something like that. So these things are going to happen, MCI and all are there. So right now in the last 2 years, the pharma industry has been tightened now where, what was happening before and now it has been regulated in terms of the so-called, kickbacks or whatever was happening. So that has come to a more or less of a stop. So similarly, I think overuse of procedures and all will come under. It is a matter of time. It is going through the correction process.
On this
Wait,
note,
you can actually come back and answer offline.
on this note, I must say healthcare in India is something that can be endlessly spoken about. I'd like to thank the panel and Hitesh for doing a very, very good job in bringing out a range of issues, and there's a small token for them. So thank